Welcome to a Healthy Living video blog at workoutmaster.com. This is Ruben.
And this is Aram.
Today we're going to talk about back pain. This is part 3, gender specific. We're going to talk specifically about females because females have a very important consideration that they should take because that will predispose them to the back pain.
So in other words, basically females have the same issues that males can have. Plus their own.
Yes.
Which adds quite a few more to them.
Absolutely. So one of the things that females do have, you guys get a period, generally once a month, and at the particular time of having a period, you have certain hormonal changes that can possibly destabilize your body. Let's talk a little bit about it.
Yes, as you ladies know, we don't have to tell you, during your menstrual cycle, certain hormones are going to be surged through the body that can actually help you destabilize the muscles that support your body, most likely the spine and the hips. So when this happens, it's very important that you take special care of yourself. As you exercise, you have to be a little kinder to yourself. So that means that you have to decrease the amount and the intensity of your training. Stay away from working or doing exercises that require no stabilization whatsoever, because it will further kind of numb your body, for the lack of a better term right now. And it's very important that if you're working with somebody else, that you convey that you're going through your menstrual cycle, that particular, or those few days that you're going to be training. It's very important that you do that so the person can make the adjustments necessary so you don't put yourself through the ringer exercise-wise.
Absolutely. Now another thing that happens, females tend to get pregnant. Anytime you get pregnant, obviously that affects the intra-abdominal pressure mechanism. You would want to make a very important adjustments if you are pregnant. You want to say anything about that? Yeah,
well, you'll perfectly know that as you're gaining weight and your body's adapting to the pregnancy level, there's going to be different changes of hormones, and the body will shape. It's very important to realize that as you change that shape, that you will be more predisposed to having a more aggressive anterior pelvic tilt, to have more weight carrying you forward, to, with the increase of breast size and stuff like that, can actually reduce the curvature of your lumbar spine, and that in itself will be one of the main reasons why you will have back pain, other than the pressure of the fetus itself on the pelvic floor musculature.
Now, after the fact you give birth, it's also very important to realize that muscles don't necessarily just jump back to original condition. There is still instability in the midsection. C-section specifically quite considerably destabilized midsection. So you do want to take in consideration, if you had a C-section or you just gave birth, you don't want to jump into high level activities. You do want to first work on make sure that the intra-abdominal pressure mechanism works, and only after that you would want to introduce some sort of a heavy training into your schedule if that's what you're looking for.
Absolutely. Not to mention that, with women, when they create, when, for example, let's say that they actually get breast implants, or they are very large breasted, they can actually cause a lot of strain to the ligamentous system of the body, increases the thoracic curvature, creating more of a kyphotic posture, and that itself will cause a predisposition to back pain.
So basically what happens if you have a larger breast, you tend to slouch, so you do want to make specific adjustments to make sure that you train your upper back so you can maintain a better posture, because if you cannot maintain a better posture, that will put tremendous stress on your neck and the back, and obviously that can create a back or neck pain. Anything else that you want to say?
Just to make females realize that you can have the same reasons that a male can have back pain, plus your own issues that we don't go through. So it's very important that you take very care of yourself, that you actually take in consideration those points, and that you address them not only as you go through your training programs, but as you go through life as well.
Absolutely. That's pretty much all we want to say about this particular subject. There's more episodes coming out of back pain. Thank you very much for watching. Remember, your future looks better already. Until the next time.